You might be wondering what to expect after pterygium surgery, and this is a question I'm commonly asked when I'm discussing the prospect of surgery with patients. It's probably the first time you've ever had surgery, and certainly for most people it's the first time they've ever had eye surgery. First night after the surgery is usually the night where you experience some discomfort around the eye and maybe some aching, and you'll have an eye pad on so you won't be able to see out of it. From the next day onwards, the eye will start to feel more comfortable, but surface irritation, grittiness and light sensitivity will take over. You'll be able to open your eye and keep it uncovered and use it as much as you want. But from experience, for most people, the significant light sensitivity, grittiness and irritation during those first few days does limit their ability to use their eye. You can still read, use a computer, watch TV, but you might need to have the eye closed or resting frequently. Over the course of the first week, as your eye begins to heal and the eye drops that you're using assist in this process, reducing the inflammation, you start to feel like you can do more and more. Some people end up feeling up to going back to activities such as driving and also their regular office-based work activities at this time. But for some people, it can take a little bit longer. I usually recommend giving yourself at least 2 weeks of time where your eye may not feel up to all of these usual activities. From about the 2-week mark, most people will feel very confident in getting back into their day-to-day life and activities. But during this time, it's really important that you keep your eye protected from water and from the effects of strenuous physical exercise. At the 4-week mark, you're usually able to go back into anything you were doing before the surgery, including all your usual sport activities. Another question I'm often asked is whether flying and travel is okay after surgery. Certainly, domestic flights or travelling short distances absolutely fine, but I usually recommend that you don't leave the country for around 3.5 to 4 weeks after the surgery, just in case a problem arises and you're far from home, we can do something to rectify it. After the first 3 to 4 weeks, when your eye's feeling and looking close to normal, there'll be a routine checkup with myself and I'll be able to let you know what further care you need for your eye, including weaning off your eye drops and any other measures that you might require. If you wear glasses, it takes about 3 months for the eye to completely remodel, so I suggest you wait until then before seeing your optometrist to get an updated pair of glasses. Any new prescriptions prior to this may not be perfect for the long term. I do usually like to make sure that I check people's eyes one more time after this time point to make sure that the pterygium has not shown any evidence of returning and that you won't have any long-term issues with your pterygium.